All right, welcome back, everyone. The Vitality Check podcast in the house with my compadres JJ Turnbull
JJ.
and Dr. Sean Landry, Michael Landry,
Thank you.
Michael Sean.
Michael Shaw.
Michael Sean.
Yeah.
How you guys going? How you doing?
Doing great, man.
Everything's good?
Yeah.
Yeah?
Doing great.
Yeah, really well. Really good.
Yeah?
hmm
Just living the dream before the break or what?
Daily. Yeah.
Nice.
Now that I have a slight idea about,
Oh yeah, what are you guys doing?
when I'm going to work and when I'm not going to work. So yeah, a
Oh,
little late to the game, but that's nothing new.
What are you doing?
yearly event?
Yeah, I'm not doing as much. I'm going to take a couple days off at the start of next week and at the end of the week following and just have a couple long weekends and hit the
No,
slopes,
no, you're not.
unless Kev tells me otherwise. Yeah, that's the plan.
Nice.
You guys, I know you guys have some exciting trips coming up.
We're entering
Hopefully for Sean.
war zones. Basically, Guatemala and Mexico.
Yeah.
That's where all the action is.
Really? Is anything going on in Mexico?
I don't, I don't know.
Yeah. So yeah.
So for now, you're going.
Yes, I may or may not be going, but I'm leaning towards going.
Mm.
Yeah, as I Googled, Puerto Vallarta and Tulum are 2,500 kilometers away from each other.
Mm.
So other sides of the country.
Don't
Yeah.
know what's going on.
No, unfortunate, there's something going on down there. And for all those in PVR, wish them well, hope they're safe. And when the airport opens up, they can head home or
Yeah.
do whatever. But yeah, timing is not optimal, but leaning towards still going to have fun, get some sun, be smart, obviously. And yeah.
Well, it's tough to have the kids so excited to go. And I was thinking,
Yeah.
by the way,
By the way.
we're gonna pump the brakes on that one, but maybe next year.
Yeah, no,
Right.
Anyway.
Tough,
Yeah.
but
We'll just wait for the murdering to calm down.
exactly.
Right.
Oh man, yeah,
Which leads us into our topic today of,
Stress.
jaw clenching.
yeah.
Oh, I thought we're not doing murder.
No, it's frowned upon.
It is.
Yeah.
Uh,
So we wanted to talk a little bit because we did do a podcast on we've done on many things, but the shoulder in particular, and then the topic of the jaw came up and how influential the jaw is, and that we should do a podcast just on the jaw. So here it is. We're probably gonna have more than one because one of the physios here at the clinic too specializes in
Even in our
jaw
digestive,
therapy. Yeah.
in our digestion
I wasn't finished. Okay.
podcast, our three-part series, we spoke about the jaw as well, and it's important
Yep.
with respect to digestion and mastication, obviously, and right.
Well, that's kind of what we'll do today is a bit of an overview of like it is such an essential part of the body in terms of affecting like physical structure and tensions and fascia throughout the body to, like Sean said, have an
Posture.
impact on the nervous system and your digestion, um,
Neural,
posture.
emotional, right?
And then even the tension in the jaw creating tension on the teeth, which have all the meridians leading to your organs.
Mm-hmm.
So there is a mixed bag of influence.
Facial structure, headache,
Facial structure, headaches, neck pain, shoulder pain, lateral tension pain.
appearance.
Appearance. Yeah.
Crooked jaw guy.
You don't want to be that guy.
You don't want to be that
the
guy.
crooked jaw guy.
No, you don't want to
Like
be.
Jake Paul when he took that one. Was that Jake or Logan? Jake, right?
I don't know.
Took that shot to the jaw. It's
Mm.
probably not going to move the same for a little bit.
Mm,
Mm-hmm.
nice.
All right.
Okay, so
Okay. Anatomy doc. Hit it. Hit us with the jaw. Little anatomy lesson for
Nice.
us.
well, what before we get into the anatomy,
Or not.
what would be so Jay,
Yeah.
what would be some of the things that like so people might be wondering, well, how do I know I have a jaw problem? Other than the clear obvious of that you have pain.
Pain.
It's because some people come in, they don't realize they have a jaw problem
Mhm.
until we tell them, right?
Yep.
So what are some of the symptoms maybe people suffer from
Sure.
that are maybe in and around being caused primarily by the jaw, either clenching, grinding?
Sure.
Because
Absolutely.
people always say that too, that oh no, I don't grind. Okay, well, but you're clenching probably 20 out of the 24 hours in the day. So that's probably it. It doesn't necessarily mean because you don't grind your teeth.
Not at all.
That'd be problematic.
Yeah, not at all. No, listen, like we were kind of implying, they're implicated way more than most people think they are. I would think that probably most people who aren't aware that they have jaw issues maybe will consult us for neck pain and or headaches. That's probably my number one thing they'll come in with. But then from there, we could extrapolate down, like we kind of mentioned, the whole body, right? Right down to lower back pain or whatever. But often the maybe minor symptoms that they're not associating with their jaw would be kind of like Sean had said a bit, like some clicking or noticing that there's fatigue, or they might wake up in the morning and have a little bit of facial musculature kind of tension or discomfort. Um,
Ear drainage,
yeah, ear where they feel they get
pressure.
headaches is a big one for sure. That can be pretty much anywhere, but for sure around the ear, ear infections or tinnitus, or not even the infection, but the onset. They feel like there's water in the ear,
Yep.
or there's a hollowness, or there's
Changes of sound.
changes of sound that are within. I'd say some visual stimuli sometimes can play a role. Um, just that maybe even a notice in their bite that when we ask further questions that they notice that they chew on one side versus the other more often than not because of either tooth pain or just more comfort, or they're not getting that kind of same clicking or pain with doing so. Yeah, neck pain for sure. I would say it's a lot of that, particularly like pain that goes down and maybe to the trap. Um, honestly, it's almost endless, but there's a lot.
Mm.
Yeah.
Mm.
So Sean, what are some of the things that you would do with a client that's, let's say, coming in with neck pain and or shoulder and or all the things that we've discovered to kind of show them a little bit like, oh, it is coming from your jaw,
Yeah.
and this
So,
is, maybe something we need to take care of so that, the source of the problem can be.
so one of the things, all three of us do in our evaluation is we do something called therapy localization. So when we test certain muscle groups, we can then challenge and potentially show, much like a detective would kind of show um, links to different aspects of the body, in particular the jaw, right? So we can challenge, we can test, we can use, um,
Muscle testing.
yeah, muscle
Yeah.
testing in particular to correlate further, kind of like further detective work to the jaw, and then if we do see a link between said problem, right, whether it be hip and jaw or shoulder and jaw,
Mhm.
we will then further evaluate the jaw through just some simple range of motion, opening, closing, observation, palpation of the musculature around the jaw, palpation of the cervical spine, simple, like I say, simple kind of opening, closing tests, to really get a good picture of how biomechanically the joint, or both joints of the jaw are working, before then, coming up with a treatment protocol, whether it be, looking at the cranial bones, looking
Right.
at as you mentioned, the teeth or the musculature within the mouth as well.
Yeah.
So some of the really strong jaw muscles are not just even on the outside, but they're actually on the inside of the mouth, which oftentimes patients are unaware of, right?
Yeah.
That
Oh, you're
All the way on
when
the.
Kevin puts his rubber gloves on and
Yeah.
puts his pinky in your mouth, and
Or when he doesn't.
yeah, or when
Right.
he forgets the rubber glove, and you
Oh, there you go.
know. But yeah, there are various ways
Yeah.
to evaluate the jaw, and in particular how it correlates with uh, the way you've been living, and potential
Been
dysfunctions that
compensating. Yeah.
yeah, the way you've been compensating,
Mhm.
and potential dysfunctions that are might warrant further investigation.
It's amazing when you show people that whole lateral chain, of
Yes.
fascia
Oh, the fascial chains are
from the
amazing.
jaw down into the neck, down the rib cage, all the way into the pelvis to the
Lateral
foot.
lines, the spiral lines, like everything.
So that, like Sean was alluding to, like when we're doing tests to show like where's the cause and effect here, what's the differential diagnosis? Like we're saying, showing weakness in a particular area, like whether it's the hip, the knee, or anything like that, and that the jaw is showing that it's having a cause on that weakness. It's amazing how people will be like,
Yeah.
I've had this for so long. So it shows too like how chronic this can be before there's an actual symptom that comes out.
Yeah, it shows how well we are as humans to that compensating,
Yeah.
right? How we can kind of put things on the back burner
Yeah.
and hide things, right,
Mhm.
very well. Right?
So it gets interesting when you do the testing to see like, okay, so now we know just through certain tests of therapy localization that okay, yes, there is an involvement from the jaw. Now we want to know like, okay, well, which muscle, like you said, right?
Mm-hmm.
So take them through a whole bunch of different movements of the jaw to see which muscle is actually the primary one that's being a problem. So that way people can actually do some of these things at home to release them. And because this obviously, like you were saying, doesn't happen overnight. Uh, Quite often the jaw gets compressed mostly on one side more than the other, just because of asymmetries that we have. And then there can be a whole compensation of the cranium in and around that because the jaw sits right into the temporal bones. So the therapy wise is to actually undo all that to allow the jaw to sit properly, and then have the person do some things at home to help it out. Um, so because quite often, well, in the beginning, I know for sure I was guilty of that. Is like I didn't pay attention to the jaw as much as I did after I noticed it was a big problem with people, and that you'd see these reoccurring things happening in either the shoulder, the neck, or down that chain, where people then do an activity. So imagine, you're a runner or you're anything where the body's in motion and you have one side that's stiffer than the other due to a jaw clenching issue. That over mileage can really have a pounding effect on certain joints. So it's really important to pay attention to that to see, again, be your own self advocate of looking and seeing the signs and symptoms of like, oh, am I waking up with pain? Is my spouse telling me I'm grinding my teeth at night? Is there
Mm-hmm.
wear on your teeth?
Your dentist can tell you about the wear in your teeth for sure, right? When they
Correct.
do your dental exam, they'll notice that there's wearing down of the rear molars or whatever that you
Yeah.
definitely can tell if there's clenching or grinding that's going on. Sure.
And then,
If you're cracking any teeth,
right.
That doesn't help.
Yeah, definitely if you have a cracked tooth, you're
Mm.
probably clenching. There's a good chance.
Clenching is such an interesting one, though, right? Because it's
Uh,
like, as we often say, there's a lot of psychosomatics to clenching, right?
yep.
You know, the hamster wheel or the never-ending to-do list that kind
Hmm.
of subconsciously runs through in and around up there, right? So
Hmm.
it's a big one, right? So like, as therapists, right, we can definitely help put out the fire and address certain things. But then there's a lot of work, like you talk about, Kevin, a lot of work that goes deeper within to actually figure out, okay, well, why am I clenching in the first place, right?
Hmm.
You know.
Yep. Yeah, there's definitely a lot of cause of due to stress that
Mm-hmm.
can have huge impacts on the jaw. And that's why it's very difficult. Obviously, when sometimes people will get recommendation from their dentist to wear a mouth guard or a night guard,
Mm-hmm.
which can alleviate some of the compression in the joint for sure.
Yep. And
Um,
save some of the teeth, right?
yep.
But
Uh,
oftentimes people just bite down harder when they have that
they
thing
do, or
in.
they end up spitting it out at night when
Mm.
they
Or they
don't,
break them.
Yeah,
or
or
they
they'll
break them.
break them.
Yeah.
They break them a lot.
Yeah.
Yeah. And that stress response is really interesting because if you think about, when you're in a fight or flight, holding,
Yeah.
bearing down, right? Holding the jaw. And if ever, you watch boxers, right? They're really, really
Mm,
holding, and so that short term, not a big deal, right? But long term, um, and
huge
the
effect.
huge effect, right? And just if you're unaware of this happening, not just when you sleep as well,
Hmm.
right? This is a big, we see this, it kind of goes parallel with the holding of the shoulders, right? That
Yep.
upper respiratory, apical breathing and into the traps, right? Holding everything
Yeah.
and just everything becomes matted down and stuck and contracted, right?
Yep. Yeah, you'll often see that where their shoulders are being pulled up like this. That's usually a good sign that there's
Yeah.
probably some jaw tension. Touching it and it's painful,
Mm-hmm.
another good sign.
Yeah.
Um, and obviously certain physiological things like difficulty sleeping, digestion's off, all these things can be an indicator too of, the psychosomatic effect of stress on the jaw tension, but on the nervous system and how it regulates itself properly.
Mm-hmm.
Um, and it all begins, like you said, that's 100% it. It starts with awareness. So like if you pay more attention, so you probably catch yourself during the day. We tell people all the time like that until you told me, I never noticed that I
Yeah.
actually did that.
Yeah.
So no, right there, you noticing you're decreasing the amount of wear you're doing. So then it makes it a little easier to kind of get over the hump.
Yeah, just kind of think and listen to the signs, or where when you're at rest, where's your tongue positioned in your mouth, are your teeth lightly touching? Are they, you know,
Yep.
contracted? Is your jaw contracted? And just pay attention to those signs and symptoms. So Jay, should we jump into a little bit of the anatomy and,
Sure.
and explain the hinge joint that we
Sure.
have there?
Well, I was going to add on to that too. Sure, I will. The other one too, if you do like a meditation or a yoga class, you'll often hear the instructor say,
Yeah,
"Okay, everything relax," and they usually even specify the jaw.
the jaw,
Hmm.
You know,
right?
let your jaw relax. And it's funny because
Most,
we've all done that exercise where you lay down and you know slowly try to let your whole body kind of melt into the floor, if you will. But oftentimes they prompt for the jaw itself because
mhm.
there is a lack of awareness there.
Yep.
Versus people can feel when they do their big mover muscles, they don't think about their facial
Yeah.
stuff as
Mm.
much. Yeah, well, I mean, a quick synopsis of the TMJ. So TMJ stands for temporomandibular joint for those who are not aware. So that's the junction between your temporal bone, which Kevin had mentioned is one of the cranial bones, which we learned in osteo is called the troublemaker of the head because of its far-reaching implications, with the mandible, which is your lower jaw. So they have a joint where you have the mandible has a condyle, a round kind of shaped bone, which is separated with a disc, and then the essentially the cavity, if you will, where the ball goes up with the disc separating it from the cavity, and that makes up the temporomandibular joint. These cranial bones have a small motion to them, where they rock with certain movements that we make from day to day, and it's ideally there's a ligamentous, a joint capsule, and ligaments and musculature that support it and try to optimize the environment for the jaw to move. So as we open and close our mouth to eat or to speak, there's a certain rhythm that we have when the condyle comes down as we open our mouth and the separation that exists. And there's a balance there between these ligaments and these discs that allows these condyles to slide without kind of, if you will, like butting up against the cavity, if you will, of the temporal bone. So it's there as a
Disc
shock
will
absorber.
move, right?
Exactly.
Mm.
So in extreme cases of TMJ dysfunction, people will have what we describe as either an open lock or a closed lock, where they can either open their mouth and then they can't close it, or they're closed their mouth and they're unable to open it. And that's indicative that that disc has slid off so much that now the disc is in the way one way or the other. So it blocks the whole mechanism.
Hmm.
And oftentimes it requires something like heat or something to calm down enough, and then a massive crack they'll get for it to kind of slip back into place.
Hmm.
And like the cartilage in your knees or the cartilage in your hip, that can wear out. So the more people have these untreated TMJ dysfunctions, then the quicker they can wear out that disc and create more of those TMJ issues that people can have with headaches or face pain and so on and so forth. So, like as a chiro or osteo or physio, anyone who's treating, that's our job is to specify which structures are not moving properly and address them. So whether it's the mobility of the cranial bones or the upper neck, there's many ligaments that we have these techniques to do that helps to release the ligaments. Like Kevin said, oftentimes it's one side versus the other. So there's techniques we do to normalize the tensions within the ligamentous system, as well as identify, even with muscle testing, we can identify different movements of opening, closing. We call it lateral diduction movements, and we can specify through muscle testing which muscles are primary and in a cause of dysfunction for this individual through going through that, and then being able to address that either externally through massage techniques or internally with a glove onto certain musculatures that we can then help release to allow the balance between each side to be equal so that the movement of the jaw is more rhythmical and
Mm.
harmonious.
One quick one that you mentioned is the
Yeah.
deviation.
Mm,
No,
So
just
if you
S
look in the
S
mirror
curves and
yep.
and have a straight line in the front here and open your jaw, just notice to see if your jaw actually deviates to one side or the other as you
mm,
open your mouth. Usually towards the side it's deviating is where the issue is. Because it's not allowing, like Jason said, that condyle to open. So if it stays stuck in the back, then you usually get this effect of
Torsional movement
the
almost.
jaw moving towards that
yeah,
side. And then again, yeah, like you said, it's usually through some muscle release and cranial stuff to unwind that neck,
yeah.
off
Occiput
upper
C1,
neck,
C2.
base of the head.
And even in pelvis, I remember being in my I think it was first year, if not second year of osteo. I did my schooling in Toronto. I lived with my brother and his wife and their kids, and my niece was having some ear infection stuff. And I remember going back to talk to my professor saying, my niece is 4, I think she said at the time. She's really struggling with these kind of chronic ear infections. We haven't done much cranial stuff. What should I look at? She goes, don't even go there yet. Go down to her pelvis. Take a look at her pelvis. I bet you she has an upslip on that side.
Mm.
And sure enough, she did. I corrected her upslip and she didn't have any ear infections again. And she explained to me the next day, she goes, and I said she did. So we'll see how things go. She goes, well, think about it. When a child is learning how to walk, they're usually just in their diaper, nothing else. And how many times you see a child just kind of and kind of plop back and land right on their bum, like repeatedly. And she goes, it's so common. You'll see one side right up.
Mm.
And like you guys had mentioned, that whole lateral fascial chain can get
Yeah.
blocked right up to that temporalis muscle in the bone. And sure enough,
Also,
we see
just
it often.
morphologically, look at the bones. Like look at the mandible, right, and the symphysis, and then look at the pelvis and the pubic symphysis and the joint, right, the hip joints.
Same.
They actually look almost identical, right,
And
in
movement.
there,
Yeah.
right? So it's
Yep.
really important yeah, to balance those, right, to balance the hips and pelvis and the jaw and the upper cervical, right. So it's to have, right, nice tone and tension
Yep.
between those lines, right? Um, yeah, I can remember so chiropractically, yes, we can adjust the joint, right? So if again, depending on how the capsule and how the joint is sitting within the space, and I remember a few years back, one of my patients came post dental work and lockjaw, full lock, and I hadn't done a lockjaw in a while since early on in practice, and it was probably, I joke, I even as a practitioner, one of the most terrifying adjustments we did together. But I could just fit my thumbs in his teeth or on his bottom molars, and at the same time as he opened as much as he could, I tractioned down, back, and forward,
Mm.
and he was locked on both sides, and it was the
Loud.
loudest, loudest release we've ever seen, and it was instantaneously his the mechanics came back to his jaw. But it was a very, I haven't seen something as severe as that in, I think that's, one in whatever, no idea. But it was the pain he was experiencing to instantaneous relief was
Yeah.
pretty incredible. Now, fortunately that doesn't happen very often.
A lot of people,
You
that's a
know.
good mention because a lot of people, the like really, really tense ones are responses to toxicity as well, right?
Hmm.
People could have this tension in their jaw because of toxicity, especially if there's a
Mold
uh,
or not cavities, fillings,
infection
infections.
in the root. If they, let's
Yes.
say, with particularly with root canals, things like that, that potentially can have.
Yeah.
Um, so those are all things too. So quite often it's determining whether or not also is there a tooth problem that's underlying the jaw problem? Because then if not, it's going to come back for sure. But then normally most people are will say yes, that tooth is often a problem with me.
Hmm.
And like we said before, there's so interrelated with the organs. So there's a very cool diagram of that if you wanted to see the meridian structure in the mouth. It's very cool. So certain teeth are responsible for certain organs. So it could be related to
Yeah, the
something.
periodontal reflex, right? The
Yep.
pressure, right? Your teeth are actually supposed to have everything's a pump, right? And pressure gradient. So the alignment of your jaw and your teeth, so respiratory system as well, right? We have to make sure that the sinuses are clear. You can breathe through your nose efficiently.
Yep.
Um, Yeah, that's a very good point. All the making sure the teeth are in contact with each other, because it's
Mm.
the pressure and the almost, let's say, so to speak, massaging that takes place, and the piezoelectric effect too of the actual teeth, right? The crystals of the teeth coming in communication with each other,
Mm.
has influence on the jaw. One last thing, one of my mentors I used to say was, again, the psycho never, you definitely have to deep dive within the psychosomatics of what's going on. And he always recommended, I remember I did a TMJ conference and the last 2 hours he spent was just on journaling. And he goes, all right, so we can help people, right? You can help, but unless they take a deep dive of what's going on inside. So he goes, the cheapest, most effective
Empty the
way
glass.
was exactly like you say, just like download your day, get shit off your chest, off your subconscious, off your mind, get it out onto a piece of paper. The written form carries is very powerful. Um, Start with just that, downloading your day, and you see, the more consistent you with it changes, right? You hear Jay mentioned about, when you do a meditation or yoga where they talk about
Yep.
relaxing the jaw or gratefulness, right? Well, to get to gratefulness, you still got to get shit off your chest, right? So
You got to
start with,
release some of the
you got
debt.
to release it, right?
For sure.
Just what that if I can recommend to every person, just have a little notebook, a journal, and just download your day, get it off your chest.
Yep.
It helps with sleep, which then helps with recovery. It helps with, just
Leave
working through
space
things.
for the body to actually fix itself.
Exactly,
Yeah.
space. So, and it costs nothing, right?
Yeah.
You can hop on Amazon and get a journal for what, $5,
So like
Exactly.
I
Yeah.
think I said that the horse carriage analogy, right?
Not this time.
No.
No? Not well, I
Got
mean
one
at
on.
some point.
Oh,
Yeah.
Uh
My analogy though. I can.
we
we
could
could.
do the smoke one if you want.
Yeah.
Is it relatable to the
You did
jaw?
tell the horse carriage at one
Horse
point.
and
Say it
buggy.
again.
So
That's good.
okay, so quickly there's this analogy about the horse carriage. So having the carriage, which
Does
is
the horse live?
with there's two horses even
Oh,
or
okay.
multiple. So the horse carriage, which is representative of the body, the person in the carriage is actually the authentic self. The driver is your mental capacity.
Hmm.
The horses are your emotions, and the reins are your jaw. So the more we get pulled around by our emotions, and we again don't take time to empty the glass, to refocus, to reset ourselves, to re-regulate ourselves, the more tension we put on
On the
those
rein.
reins to
This is true.
control the emotions. The more we try and control, the more stuff we have to control, which ends up bringing us down this lane of constantly feeling like we're trapped, right? So like that in itself is often why you have people with this chronic tension in their jaw is just that they're to refocus and bring themselves back to help re-regulate themselves again to pay attention to that person in the back in the carriage that's actually supposed to be telling us where to go. So, quick analogy there about that. And that's it. So maybe we'll just end with a few tips of what you can do to help with the jaw if you're suffering from some of these things. For sure, obviously, if it's a little more complex,
We have Steph Baker here at the clinic.
yeah.
She's,
Well,
TMJ specialist.
yeah.
Mhm.
And we'll definitely do another podcast
We'll
with
have her on.
Stephanie just to have her input on things too. But for sure is one awareness. Pay attention to during your day when you're working, when you're just relaxing. Is my jaw tight when I'm doing that? Because right there you can cut down on a whole bunch of that repetitive motion. Stop chewing gum. If you're a gum chewer and you have a jaw problem, it's like doing a bicep curl all day and wondering why your bicep hurts. You got to give it a break. So switch to mints, do whatever you have to do. So that would be another recommendation there. Then there are some great
Massage.
the
Yeah.
massage techniques to help with musculature in and around the jaw. We often give the human garage
Fascial release
fascial
stuff.
release techniques for the jaw, which are fantastic. You can find him on YouTube. Um,
Yeah, just
anything?
simple. Yeah, I mean, just simple neck range of motion exercises, right? So setting the head over, ears over shoulder, thinking tall, aligning things. Then from
Yeah,
that position, just gentle range of motion, stretching through. Um, I've even seen
journaling,
what's that?
journaling.
Journaling. I've even seen, so again, with respect to the ecosystem of the mouth, the jaw, the sinuses. So even one of my teachers used to say, gargle with salt water, but also while you're doing that, then you can breathe and stretch your neck. And because the implication of the eyes, ears, nose with respect to the neck flexors and extensors and the jaw are so important.
Hmm.
And so he says, you want to just doing that is good for, oral health and ecosystem health, but to do it with some actual stretches and will help calm things down. So
Awesome.
things like that, journaling, breathing techniques.
I often just say hot compress, face cloth over the sink,
Yes.
really hot water on that side is a great way to do a fast kind of release. It's not the awareness part, it's the opposite. If you're in an acute stage,
Yep.
really have some that hot water in a face cloth can help a lot. And I often refer to something online. I remember this from the old clinic I used to work at. I usually refer 6 exercises. It's called the Rockabato 6x6 program for TMJ dysfunction. It's chin tucks, scapular setting, opening and closing your mouth with your tongue pressed against the roof of your mouth. It's clucking sounds. It's isometric exercises. It's all about just trying to help that content in and around the TMJ. But super simple, Rockabato, yeah. But I've given it out for years and it's good. It's like you said, Sean. It's a lot of the range of motion and stuff, but a lot of like retraining of the musculature and
So far,
correct tongue
no
position.
casualties.
None yet, none yet. Most of them can't spell Rockabato, myself included, so that's helped a little.
Nice.
Yeah.
Well, we'll put it in the show notes.
Yeah.
Awesome.
All right, guys. Well, thanks for joining. We'll see you next. No, well, we're gonna.
I'm doing one by myself.
Yeah, Jay's soloing it.
How do I do
So,
this again?
Good luck.
Set it up.
Have a wonderful week, everybody.
All right, take care.
Cheers.